Hello, welcome. Welcome to the Academy. We are here to learn. And today's subject is the gallbladder. It is a very personal subject, and I will tell you the whole story. My name is Magdalena Bednarek. If you need to know more about me, there is an introduction video that I highly suggest you check it out. Um, this video is strictly for educational purposes only. I need to add a medical disclaimer. I am not here to take responsibility for you, nor am I willing to. I don't know your case. This is for you to learn whether you have a gallbladder or you don't. It is a vital energy within your body, and you are here to learn, and I am here to provide education. Everything that I have learned in medical grad school and everything I have experienced on my own. So, this is your gallbladder, the very green substance. As you can tell, it is directly connected with your liver. It is also connected with other parts of your body. It goes straight to the pancreas, to the bile ducts. It releases the bile when the stomach contracts, when the signals are sent. I want you to have this image in mind when we talk about the gallbladder. Why? Because I want you to understand your anatomy. I want you to learn when we talk about an organ, and there's going to be many videos on many organs. I want you to have an understanding where it is in your body. The first thing you need to know about gallbladder attacks is the pain. It is in the right upper quadrant of your abdominal wall, which is for us women right underneath our right breast. The pain is so severe that you will not be able to miss it. Like there's no way for you not to know that this is your gallbladder hurting. Number one, because the liver doesn't hurt. It has no nerve endings, so it's impossible. The liver can get swollen and push on other organs, but it cannot physically hurt. So if you have pain in the right upper quadrant of your abdominal wall, that is possibly a gallbladder. The pain is so severe that it's paralyzing. And it happened to me on Friday. It happened to me 5 days ago. I was in the shower, and all of a sudden I felt this horrific pain to a point that I couldn't move. And so those of you who had gallbladder attacks in the past, you know what I'm talking about. Those of you who don't, you don't want this. So we will talk about the prevention. Prevention is very, very important. In America, more than 1.2 million surgeries per year to remove your gallbladder, although your gallbladder is innocent. Did you know? Maybe you didn't. The gallbladder doesn't have a function to form stones. The only function the gallbladder has is to store the bile, and the bile is not made in the gallbladder, it is made in the liver. It stores the bile and it releases. Those are its only functions. So, if the gallstones are not produced in the gallbladder, where do they come from? Well, of course, they come from the liver. But Western medicine does not address the liver issue. They just like to, in my opinion, they just like to remove the symptom, because that's exactly what it is. I've had a patient when I was doing my clinical internship in acupuncture who had gallbladder removed 10 years ago, and she was coming with gallbladder pain because the gallbladder was never the issue. It was actually her liver that was suffering. Their liver was unable to regenerate because it was missing main components, amino acids that it needs daily to regenerate. And our diet is very poor. So we're going to talk about this too. The main reason we get gallstones is emotional. And I know some of you don't want to hear it, and that's fine. You don't have to be here. This is a choice. How is it emotional? In traditional Chinese medicine, gallbladder is connected with your liver. The liver is responsible for the emotion of anger. Gallbladder is your resentment. It's your suppressed anger. It's that grudge that you've been feeling for many, many years. Perhaps you even forgot about the grudge. Like someone did something horrible to you when you were 5. You totally ignored it. And all of a sudden you wake up with this horrible pain and you don't know what's going on. That's your gallbladder. That's the energy of the gallbladder, and energy is always followed by your emotions. So the more you hold grudges, guess what? The more issues with the gallbladder we're going to see. And it could be multiple issues. It doesn't have to be just gallstones. For many people, they have too much bile or not enough. And how do we distinguish that? Well, if your bowel movement color is yellow, if it's fatty, that would mean you're not processing the fats correctly. In order for your body to process the fats that we eat, and by the way, yes, we need the fats, we need the cholesterol. All of your hormones are made from cholesterol. If you want to have healthy hormones, guess what you need? You need to eat fats. But without proper amount of bile released at the exact time, how is your body going to be able to take care of that and allow it to be absorbed? It's not. It's just not going to happen. Now, going back to the gallbladder meridian, the most common areas of pain that we see in traditional Chinese medicine is pain in the knees, pain in the hips, pain in the shoulders. That's because that's where your gallbladder meridian goes through. So we know right away that there's some kind of grudge you're holding. There's something unresolved within you. And it is not up to us, it is up to you to find out what is there that you are unable to let go, because it's all about allowing the emotion of anger and getting rid of it. Now, in recall healing, because as you know, I'm also certified health coach in recall healing, which is a branch of German New Medicine. It is also about holding the grudges. Now, the total biology of your body has all the tools to heal, all of them. Your body's perfect. Believe it or not, your body has all the tools to fix itself. All it needs is a signal from the brain. That's all it needs. There's nothing to it. This is what your body does. If there is no signal, that means that we are unaware of an issue. And there's a story in the Recall Healing book by Dr. Gilbert Reynaud, who says that there was a man who had severe gallbladder attack, but he didn't qualify for surgery. But once he realized that he was holding a grudge towards his father, and he processed that grudge, magically, the stones were dissolved, and he had no longer any pain, and his digestion magically, naturally came back to normal. Why? Because his brain decided, oh, the issue's resolved. Now I'm safe. I feel safe to send the signals so the body can take care of it. This is the wonders of our body, guys. I've been talking about this for possibly last couple of years, how your body is a map. If there's something wrong, especially emotionally, your body will send you the first signals. And we just need to learn to read this map that is our body. But what do we do instead? At the first sign of pain, at the first sign of symptoms, we run to the doctor, we run to the hospital. And I'm not saying that that's bad. I am definitely not. If this was me 7 years ago, that's exactly what I would have done, because I wouldn't have the tools I wouldn't know what to do, how to help myself. I didn't trust my body. The only way for you to know what to do is when you trust your body and when you educate yourself about your body. And this is what we're doing here right now. Everything you need to know. Western medicine approach. This is more of a functional approach because doctors don't like to talk about it. So why do we get calcifications in our gallbladder according to our anatomy? Well, if we understand now that the purpose of the bile that is stored in the gallbladder is to process fats, and it's not being released, and it just sits there, and it gets calcified, that tells me that your diet is low in fats. And believe it or not, all of us have been manipulated into the low-fat diet. We were told that fat will make us fat, which is an absurd from a nutritional standpoint. Fat doesn't make us fat. We need the fat. Like I said, our body loves cholesterol. Our liver uses it to produce our hormones. Without it, we have such severe hormonal issues that, guys, it's impossible. It's impossible to have a normal life without normal digestion, without normal hormonal expression. So this is what we've been manipulated with. And even me, I know I don't get enough fats. I try to. When I was working a couple of years back with a personal trainer and she had me on a diet, this is when I realized how little fats I've been consuming. Because when I started counting the macros, when I started implementing, oh, I need 20 grams of fat for breakfast, 15 for lunch, 10 for dinner, whatever the amount based on the way you move, your height, your weight, whether you want to gain weight, whether you are in reduction, you need to eat certain amount of fats. And even if you go to a store today, and this is a fun fact, if you go to a store, it is very hard to find a whole fat yogurt. All the yogurts are reduced fat or fat free. And that is just programming. That is just manipulation. So I am definitely not afraid of butter. I love my ghee. I love my olive oil. I add it to everything that I can possibly, because and we'll talk about it later, what I actually do as a part of a protocol to kind of reverse or fix the gallbladder attack issue. Which now I'm fine. I think I have it under control, but I'll still continue doing my protocol. The other reason in Western medicine why we get calcifications in the gallbladder is simply because we don't have enough of vitamin C. Yep, none of us. It is impossible in our time to get enough vitamin C from the food. The food that we eat doesn't have as much vitamin C as it did 50 years ago. So unfortunately, we are kind of made to supplement, and we do not eat nearly, or we do not supplement nearly enough vitamin C. The studies that are done in Western medicine are all based on 250 milligrams of vitamin C per day, which Western medicine says it's useless. Of course it is, because I don't know, even a baby needs more vitamin C than that. I cannot recommend. I do not know you, so I don't know how much you are supposed to take. But what I can recommend is reading a book by Dr. Rath entitled "Why Don't Animals Get Heart Attacks, But Humans Do?" He talks all about the proper dosing of vitamins and minerals. And by the way, you cannot balance your minerals without balancing your vitamins first. And please notice how when you go to for your regular yearly checkup, your doctor does not check vitamin C, vitamin K, vitamin A, vitamin B3, B2. They just don't. Why? Well, if they did and they found out you have to supplement, it would be an easy fix. And that is not what Western medicine is all about, because it's all about profit. So, not enough vitamin C. Again, Dr. Rath book. I can tell you how much I take. My body is fine from anywhere from 2,000 to 3,000 milligrams per day. That's when I feel the best. That's when I regenerate. That's when my wounds are healing. And for years and years and years, I was deficient in vitamin C. And I actually did micronutrient testing a couple of years ago. And it turned out that not only my vitamin C was low, but I was deficient in absorbability by 140%, which right away let me know that I didn't have enough stomach acid, because if you don't have enough stomach acid, you can't absorb vitamin C, iron, or B12. And it's most of us. And the most common cause of that, of course, is chronic stress, which we will talk about in another video because it probably deserves a book. I mean, what stress does to us, it's like crazy. Okay, we talked about the aspects. So not enough fat in the diet. And another thing is, if you are afraid of fat, if you are overweight, if you are swollen, if you are obese, and you are really scared of fat, the fat that you will consume, just because you heard from me that it's good, it will make you worse. You gave it power. You gave it your fear. Unless you trust it, unless you trust your body, unless you trust the process, there's nothing we can do. Guys, everything wrong within our body is emotional, and we give it energy. Like I said, liver meridian, anger, gallbladder, suppressed anger, the grudges that we hold. The easiest way to get a grudge is to turn on the TV and the news. That's the easiest. They literally make you hate people. They tell you who's good and who's bad, and then your brain follows, and that's how you keep grudges. And so no matter what you eat, if you have the cleanest diet on the planet, but your thoughts are negative, guess what's going to happen? You guessed it. There's going to be some sort of dysfunction. It's impossible to have health without healthy thinking. Okay, let's continue. What did I do? Like I said, Friday, 5 days ago, I had severe pain in my right upper quadrant of my abdominal wall. It was bad to a point that I couldn't do nothing but to lay down. And that's exactly what the body needed, is the rest. And I hope you have opportunity to do it. I was glad it was Friday and I had the whole weekend to actually continue with my healing. So I rested. And the next thing, I knew right away what I have to do. I have to fast. And there's another video that I published on water fasting. I fasted because I needed to reduce inflammation. Fasting always turns on autophagy, which is the self-cleanup process of the body. But with gallbladder issues, we do not want to fast more than 24 hours. Why? Because if there is bile stored within the gallbladder, we want it released. We don't want it sitting in there, aggravating us further. Sometimes also, it depends on how many stones you have. I didn't have a lot. If your gallbladder is filled with stones, I would get it definitely checked out by a medical professional. Now, I don't like the fact that they removed the gallbladder. If it was me and I couldn't resolve my own issue and I went to a doctor, I would argue with them to cut open my gallbladder, remove the stones, sew it back on, and leave it alone. Why? Because every time there's a part of you that is removed, your brain spends the rest of your life trying to rebuild that tissue. That's what the brain does. This is literally our DNA. Part of your DNA is regeneration. You can regenerate any cell within your body. But it takes a lot of energy and it takes a lot of effort, and there's more healing to be done. We're constantly being exposed to pollution. We need our detox. There's so many things that the brain can do at once. So we don't have time to be laying down in bed for a few months just so that the brain can regenerate our tissues. But this is the policy, guys. And I think whoever came up with the policy to remove your gallbladder instead of just cleansing it, they were in it for the money. That's just my opinion. I know there's other ways, if you don't have a severe attack, that they would use like echo sound waves to break down the stones. This is definitely something that I would consider because then once it's broken up, the stones are broken up, they can be excreted and removed from the body. So there's options out there. When we get a gallbladder attack, the pain is so severe. We want it out. We want it gone. We're just like, oh my God, take it out. And in many cases, surgery is necessary because if left alone, it can literally cause sepsis. And yes, people can die from it. It can cause a whole body inflammation. It can be the reason for poisoning your body. So that's why I said, this is not a medical advice. This is for educational purposes only, because we're all different. For me, I had only 2 stones, but imagine if you have 30, 40, or a full gallbladder filled with stones. My grandma had her gallbladder removed at 82, I believe. And oh my God, there was no room in there. So what I did would not work on her, definitely. So there's a time and place for everything. I am sharing my story with you to let you know that yes, it is possible to get rid of the stones naturally as your body was made to do it, but it really depends on your situation. Most of us don't even know what we have in our gallbladder because we never get an ultrasound and our doctor never sends us to. I wonder why. They just leave us be. And then once the pain is there, boom, you go and you get the surgery and you're part of the 1.2 million people who get their gallbladder removed. So I rested and I fasted. So I stayed in bed until the morning. In the morning, the first thing I did was I had 1 tablespoon of olive oil. Make sure it's nice and clean and good quality olive oil, along with 1 tablespoon of freshly squeezed lemon juice. I took it as a shot. And what this does, because it's pure fat, It makes the gallbladder contract and release whatever is there. Because anytime you eat fat, and remember, your digestion is like this amazing tool you have. The moment you have food in your mouth, the saliva secretes signals to the stomach. So the stomach is already prepared. Oh, I'm going to make this enzyme and this salt and that. So it all starts when within your mouth. So then it goes down. And once the olive oil hits the stomach wall, it sends a signal to the liver and to the gallbladder to release the bile. So that's what I've been doing ever since Saturday. So for 4 days now. And it's improving greatly. So that's number one. You can also Google it. There's a lot of information about drinking olive oil and lemon juice in the morning. So this is something for you to research. I always encourage you guys to do your own research. Trust me, but don't believe me. Do your own research. Next thing I did throughout the days, once I was able to move, once I didn't have to stay in bed anymore, red light therapy, near infrared light. It has tremendous anti-inflammatory benefits. It helps the body produce its own collagen. It helps the body regenerate. It's like sending signals to improve your mitochondria. I use it often, but within that, I would do like 20-minute sessions multiple times per day. I use Orion RLT, and you can check them out. It's orionrlt.com, and my discount code is MamaLena. It's amazing, guys. I've been using it for years. It's medicinal quality, so it penetrates the skin. Now, the thing is, to do red light therapy correctly, you have to be consistent with it and you have to be laying down. Just like when you're suntanning, the best way to suntan is to lay down and relax, because when the muscles are relaxed, that's how the sun penetrates through our skin. When we are tense and we are flexing our muscles, it is much harder for those signals to get through the skin. So I do the same thing. I have my station with red light therapy, and I just lay down and I allow the body to do the work. I trust the body. Now, at that point, my pain was already reduced by 50%. So again, listen to your body, because if it's pain that is paralyzing you, and if it lasts for more than you can stand, please do me a favor and go to a doctor, go to a hospital, because that's, what I'm telling you is less severe case. Next in line was coffee enema. I have a video on how to do a coffee enema on my Instagram, Universal Mama Lena Academy. I love coffee enemas. I know they're not for everybody, and some people are highly grossed out by them, but it's your choice. What do you think of them? I was highly afraid of doing one. I'm not sure what I was afraid of, but once I did it, it was amazing, and I never felt this calm in my life. Seriously, never. And what coffee enema does is, of course, you insert it through your anus and the coffee goes into your large intestine. Your large intestine is then connected with the liver through hepatic portal vein, and it boosts the liver's production of glutathione by like 700%, which is crazy. So it's not doing anything for your body except helping your own liver to detox. And your glutathione is your number one antioxidant. There's no better one. It literally gets rid of anything that doesn't belong in your body. Like, that's your liver. Your liver is your general. Your liver is your filtration system. So you want to make sure that it's getting all the help that it can. So I did that. Now, along with the coffee, of course, you have to get high quality coffee, not regular coffee, because God forbid it has mold in there. And there's no regulations in the States. You get a specific coffee. I also have that on my Instagram page. I added a Peruvian herb, chancapiedra, which literally translates into stone breaker. And in Peruvian medicine, it is used as a tea or as an enema to help break down stones, not just the gallbladder stones, but also the kidney stones. Now, kidney stones are a little different. They're typical calcium calcifications. And in those cases, I always say, check your vitamin K levels, because it is the vitamin K that allows your calcium to go straight into your bones and not calcify and form stones anywhere else outside of your body. People get calcifications everywhere, not just in their gallbladder, kidneys. That's how people get the masses, that are literally right underneath the skin and have to be removed surgically because it's almost impossible to squeeze them out through the skin pores. But that's what happens to us. And there's a great video of Spencer Feldman who was talking about how we are all turning into stone. Why? Well, our diet is high in oxalates, and nobody told us about that. We are very low in calcium, and especially those of us like me who are lactose intolerant and do not drink sufficient enough of milk or eat calcium within their diet. So we have to supplement, but first of all, we have to check. I will never recommend for you to take calcium without first checking it within your body, getting blood work done, getting micronutrient testing done. That is important. But yes, diet plays a major role. And then the other thing is the emotions, because turning into stone is like literally, I don't want to be here. I don't like my life. I don't want to be here. So the body is a receiver. It receives signals from your brain. What are the signals sent? I don't want to be here. Well, then let's give you a disease. You'll be gone quicker. This is literally the biology of our body, guys. And I did cupping and I did acupuncture. Now, first time I had the gallbladder attack was about 3 years ago, maybe 2.5 years ago. And back then I was in medical grad school learning acupuncture, learning herbs. So I went to an acupuncturist, and there's actually one acupuncture point on the body. It's amazing. Even if you press on it, it brings release, but it's better to have it done with acupuncture. And it's specific for gallbladder attacks. I love it. It's on the leg. So I was able to do it myself now, but back when I didn't know how to do it, I went to an acupuncturist and I had cupping done and I had needles down to calm the system down, to calm the liver down. And it brought tremendous results. There's also herbs that you can take that are recommended, and many acupuncturists do have it. Now that I graduated from medical grad school with master's degree in acupuncture and herbs, I can do it myself on me, of course. So that's what I did. I did cupping on all over my liver because the pain from the front many times radiates into the back. Sometimes it's even rib cage pain, because there's inflammation in there. Anytime there's inflammation, there will be pain. So what we want to do is reduce the inflammation. And then, so that was a huge part of my recovery. Right now, I would say I still have pain. I just feel it. It's about 10%. Doesn't restrict me in any type of movements. So I'll continue what I'm doing with red light therapy, with the olive oil and lemon juice, with the cupping, and just a nice and light diet. I do not overeat and I do not eat anything at night, just to help my body digest. When you already have your gallbladder out, what do you do? Well, I'm sorry to tell you this, but your digestion will be affected. And if you try to eat low-fat diet, because probably that's what your doctor told you, who is not a nutritionist and doesn't know the importance of fats in your diet and how it will affect your hormones. And depending on your age, as women, we need all of our hormones, especially the older we get, in order to be healthy. It's not just about healthy libido. It's about having energy, having clear mind, having focus, having motivation. It's all of those things. So we do need to consume healthy amounts of fats. You can calculate those. You can go on Google and you can Google calculate my macros. It will tell you everything based on your lifestyle, based on your height and weight. This is something you can do for yourself. But if it's too late, if you had the pain, if you had your gallbladder removed, what do? Well, there's two supplements that I always recommend to patients with no gallbladders. First one is the bile salts or ox bile. I know Seeking Health, Dr. Ben Lynch has an amazing supplements. And yes, you actually do have to take it before your meals, possibly 15 to 20 minutes before. Why? Because when you don't have a gallbladder, your liver still produces the bile. That didn't change. The function of the liver will not change just because there's another organ missing. It just doesn't have anywhere to store it. right? So what it does, it's usually there's bile already stored. When we eat fat, it's just released. But when it's not stored, the liver has to produce it right away. It, of course, in this case of events, it will stop doing other functions because it has to get to digestion. The liver literally saves our lives every time we eat, especially when people drink alcohol, because alcohol turns into ethanol and it's poison. So thank our livers. And our livers don't get enough of our loves, and they should. So the liver continuously working the moment it feels that you have food within your mouth. And it's a strain on the liver. So to help the liver, when you take the ox bile or the bile salts, the body is prepared then, and there's no such stress on the liver. You're kind of taking off the burden from the liver. Now, another important supplement that you have to take, and there's multiple companies who make it great. Cellcore is one of them. It's the TUTCA. TUTCA is an amino acid that is really, really helpful to stimulate the correct function of the liver. And with the liver doing, oh my God, I've read an article that the liver does like 500 things at once. It probably does more. It is your liver that dictates where the vitamins and minerals will go. It is the liver that sends all the antibodies whenever we're sick. It is the liver that controls where the fat goes. The liver the liver cleans the blood. The liver cleans the body. The liver is just nonstop working, nonstop. You guys, it needs support. Now, another very, very important thing about the liver is that it regenerates very fast if you provide it with the correct building blocks. And those are, of course, amino acids. And I'm talking here about taurine, glycine, and lysine. Those three amino acids. Now, there's multiple supplements. If it's an emergency, my favorite supplement is Spencer Feldman's. His website is remedylink.com. I had it at the back of my brain. Remedylink.com. He has a suppository. It's called glytamate, I think. It's the liver protocol, and his suppository is being absorbed right away. Why? Because it's a suppository. So like I said, when we do a suppository, it goes through our anus into large intestine, and then the supplement is literally being transported through hepatic portal vein into the liver right away. So we're bypassing the whole stomach process, because when we take something orally, the whole process takes place in the stomach, where we're literally maybe getting very little percentage of the actual supplement, because the rest is just gone with the stomach acid. So we're bypassing it. This is why I love liposomal supplements, because it's in the form of water and we don't get stomach acid involved. So there's different forms of supplements. For this, I really, really love the suppository from remedylink.com. Spencer Feldman has a whole protocol on how to rebuild your liver, how to help the liver. Without the healthy liver, there is no health. So if we can support the liver, what I love is Cellcore has this wonderful powder, which is taken in the form of drink, and it is called Glyinactive. It has all the amino acids. It tastes wonderful. And again, if you would like to sign up with Cellcore, send me a message on Instagram and I will send you my practitioner code, and we can start working on your liver. There's also multiple herbal protocols that we can do in order to help our liver. So I hope this was helpful. I hope you know what to do. And no, low-fat diet is not the answer. It is not. And it will not help you be skinny. That's not how it works. It is not the fat that makes us fat. Fat is very important in our diet. I want you to keep that in mind. But the body needs to have the best ability to absorb it. Just like we have fat-soluble vitamins, guys. Without fat, those vitamins, which is D, A, K, and E, you cannot absorb them. And so many doctors will not even tell you that because they're just not taught. So that's all the information I have for you about the gallbladder. Stay tuned. There will be more on different organs. If you don't follow me on Instagram, I highly invite you to. It's Universal Mama Lena Academy, and I will see you soon.